If you're living with chronic pain, chronic fatigue, or a body that won't stop hurting, no matter what you try, then I want to introduce you to mind-body medicine. It's what got me recovered after more than 30 years of chronic pain and chronic symptoms. I'm going to share with you some moments from an amazing book, Unlearn Your Pain, and I'm going to talk to you about this mind-body medicine that Dr. Howard Schubiner is presenting in this amazing book. It's a book that has 5 chapters introducing why you may have chronic pain, chronic anxiety, chronic illness, including fatigue and other persistent physical symptoms. And then it has 7 chapters, which is a workbook of questions for you to start working on your brain rewiring. So you might like to get comfy and settle in. And if this is the first time that you're hearing about TMS, the mind-body syndrome, then I can link for you to other videos that also explain what it means. There is an amazing theory from Dr. John Sarno, who was Dr. Schubiner's teacher. In the 70s and 80s, Dr. John Sarno, who was an American back pain specialist, he developed a theory that back pain wasn't really being caused by structural damage. He was seeing hundreds and hundreds of people, and they would come to him and their x-rays and scans would show slipped discs or herniated issues and spurs on the spine. But those had no correlation to people's pain. He started doing x-rays on people who didn't have back pain. He started doing research to see, do these physical manifestations actually match up to the pain? And he discovered this amazing thing that no. Now, I'm someone with a slip disc. I'm someone with 30 years of chronic back pain that then I had other symptoms as well, and it turned into chronic fatigue syndrome and long COVID. So the theory is simply that it's not the physical structural issue in your body that might be driving what you're experiencing. And then that begs the question, well then what would be driving my pain and symptoms? And the answer is, according to Dr. John Sarno and Dr. Howard Schubiner, that repressed stresses and repressed buried emotions from the past are held in the system, and your mind-body system, your nervous system and brain together will create a diversion in the form of pain or other really horrific, very real, painful symptoms in the body. So let's have a look. Let's hear from Dr. Schubiner. Unlearn Your Pain, a 28-day process to reprogram your brain. He's got a big disclaimer at the beginning. I'm just going to skip that, but I'll tell you the first line. It just says, reading this book does not establish a doctor-patient relationship with Dr. Schubiner. Okay, I feel that we're clear on that. If you're watching me in this video, you know you're not a patient of his when I read it to you, I believe. Chapter 1, the truth about your pain. Telling people about mind-body syndrome is like telling them that the earth is round when they know it is flat. A quote from an anonymous patient. And then we have some Latin. Excellent. Vitiant artus aegrae contagia mentis. When the mind is ill at ease, the body is affected. Ovid. It hurts. Your pain is awful. Here, I like how the layout is. It hurts really big with space around it. Your pain is awful. Your misery is unrelenting. No matter what you do, you can't get rid of it. You went to your doctor and he told you that you have a medical condition, degenerative disc disease, spinal stenosis, fibromyalgia, irritable bowel syndrome, whiplash, or something else. Your doctor prescribed drugs. You took them, but they didn't really help. Maybe you even had surgery, but that didn't stop the pain. Whether it was in your back, your head, your neck, your gut, or all over. Perhaps you've explored alternative medicine. Maybe you took herbal remedies, had therapeutic massages, or saw a chiropractor. You're considering acupuncture, hypnosis, and even crystals, if that might help. Some of these treatments may have provided temporary or partial relief, but still the pain is there, day after day after day. I like the way he says, even crystals. I've got to say, definitely crystals. I had all the crystals. I think that a lot of people on a chronic illness journey like mine was, is you go through all the doctors and you run out of all the things they can give you. Then you go to the naturopaths. Then you go to shamans and acupuncturists and crystals. And then you kind of run out of things. And then you find the really, really, really severe, wild treatments that sound crazy. And then you do all of those. And then when you get to the end of all of those, you finally discover mind-body healing. That was my journey anyway, thank goodness. But it was right at the end. I think I tried every physical possibility first. You've gone to so many health practitioners that you are starting to feel no one can help you because no one understands the real problem. Maybe your doctor even referred you to a psychiatrist or psychologist, suggesting that your pain isn't real, that it's all in your head. But you know you're not imagining it. You're not faking it to gain attention or sympathy. It's about time someone in the medical profession recognized that the pain in your body is real. It's about time that someone in the medical profession told you that there is a reason for your pain and a way to cure it. I am that doctor, and I'm telling you, your pain is real. There is a reason for it, and there is a cure for it. The only way to relieve the pain is to find the underlying cause of it, to get to the bottom of it. The problem is not in your head, it is in your diagnosis. Some doctors may say you have a serious medical condition, but if they don't know how to cure it, their diagnosis doesn't help you. Perhaps alternative health practitioners will tell you that your spine is not properly aligned, or your aura is out of whack, or your chi is diminished. I think he's saying these things dismissively. Your chi is diminished. Okay, all of these are different ways of looking at your body, but none of them will succeed if they're not correctly diagnosing why your body hurts. I have some good news for you. Unless you have a medical problem resulting in clear pathology in your body, which can be determined by routine medical tests, your pain can be cured. I feel like that just contradicted the earlier parts, because even if you have something showing up on scans, according to Dr. Sarno's books, who was the teacher of Dr. Schubiner, it doesn't necessarily mean they're causing the issue. I don't know what the reason is that he's more cautious than his teacher. Following this program, you can take some relatively easy steps to vanquish it. Like tens of millions of Americans and countless others around the globe who suffer from chronic back pain, muscle pain, headaches, migraines, stomach pains, and other misdiagnosed conditions, you're hurting because of overly sensitized nerve connections between the brain and the body. These connections have created a vicious cycle of pain that can last months, years, or even decades, unless you do what it takes to stop it. This cycle of pain signals has been learned by your nervous system. And the longer these signals keep firing, the more sensitized and overactive the nerves become, and the more pain you feel. Again, I'm not sure that's accurate. As someone who has experienced about 30 years of pain, it wasn't that the longer it went on, the more pain I felt. It would come and go, actually, and it was very bad always. I remember lying on the floor once for 3 years, and there's a film, I think it's All the Rage, the Dr. John Sarno film, and the documentarian, the filmmaker, has terrible, terrible back pain, and a lot of that film is shot of him on the floor in his house, unable to play with his kids, and I related a lot to him. Yeah, you get a lot of time on the floor if you have had back pain for a few decades. So it was bad from the beginning. The event that started this horrible pain cycle could have been an injury or a stressful event in your life, or it could have come out of the blue. A very careful and detailed look at your current situation and your life history will reveal how your brain is amplifying this pain and perpetuating the vicious cycle. The best news is that you don't have to live the rest of your life with this pain. Whether you've had it for a few years, a few weeks, or many years, it can be beaten. Just as your nervous system has learned to make your body hurt, you can use your brain to unlearn your pain. There's a way to retrain your brain so that your body isn't contorted into pain. This book will explain how that can be done without drugs or surgery by anyone with the motivation to do so. In fact, if you begin to understand this syndrome and recognize what causes it, you've already taken a powerful first step. And the rest of the steps, though they require wholehearted commitment, are not difficult. They are all explained in this book, and the whole program is laid out for you to work through. Improvement may occur within days or weeks, even if you've been suffering for a long time. Absolutely true. After 30 years, I discovered Dr. John Sarno's book, not this book actually. I read the books by Sarno, and I hadn't even read the whole book, The Mind-Body Prescription. I think I'd read 2 chapters, and the next day I was pretty much pain-free, and within a couple of weeks I was dancing around and moving, and I knew I was going to completely recover. I wouldn't say I was completely recovered because symptoms came up and they came and went, but I knew this was real. I knew this was the way out. Oh, I accidentally mentioned another book by Dr. Alan Gordon, The Way Out, also a very good book on this subject. Once you know you're going to recover, it's so uplifting. You can begin to feel optimistic even if you have symptoms. So I was very happy and excited to discover The Mind-Body Prescription by Dr. Sarno. But this one is Unlearn Your Pain. Everyone knows that if you break your arm, it will hurt. But after the fracture heals in a few weeks, the pain will disappear. But I've seen hundreds of people whose pain began with an injury but lasted 5, 10, even 20 years. Why? The body has surely healed. The answer to this puzzle is found in the connections between the brain and the body. If you have worries that part of you never healed properly, or that you have pain because it just didn't heal right, it might also be interesting to think about Joe Dispenza's work, Dr. Joe, because he does a lot of tests and shows a lot of evidence and shares that in his books and his teachings, where he demonstrates that even the biggest bone in your body, in the thigh, the tibia, only takes 6 weeks to heal. So he shows that anything that's taking longer than 6 weeks to heal, it healed, you're now into a mind-body syndrome. The good news is that the brain and the nervous system can be retrained to get out of ruts that produce pain and to activate the normal, non-pain pathways that are waiting to be used. An increasing body of evidence is showing that the brain has amazing neuroplasticity. It is always learning and creating new structural pathways. All you have to do is tap into that power and use it to reprogram your response to pain and to the factors that intensify pain. Neuroplasticity, neuro means the mind, plasticity means it can be moved, it can change. It sounds like a very fancy word, which is very popular at the moment in the world of healing, but it simply means that you can learn new things and you can change how you think and you can change behavior patterns and you can release the old ways. So if the old ways are creating pain, those can be let go of and you can create new ways, and then your brain won't create any more pain. So your brain is plastic in the sense of it can change. There are 3 major components of the nervous system that create the vicious cycle of pain. The nerves that send pain signals from the body to the brain itself, where those nerve signals are interpreted, and the nerves that send signals back to the body. The best way to end chronic pain and other chronic symptoms is by retraining the brain, the controller of the nervous system. Most people don't realize that the brain can both create and cure chronic painful conditions. Unfortunately, there are few doctors who understand this simple fact. Doctors who don't know that learned neural pathways can cause real physical pain believe that all pain originates from some kind of tissue damage in the body. When they cannot identify the tissue damage, they are perplexed and sometimes blame the patient or doubt that there is real pain. Modern medicine's treatment for chronic pain usually consists of pain medications, injections, or surgery. While these may help to some degree by controlling symptoms, they don't get to the root cause of the pain and therefore cannot reverse it. For people with pain caused by learned neural pathways, cutting-edge brain research demonstrates that it is possible to change these pathways and interrupt the vicious cycle. stress and pain. We're on to the next section. Stress and pain. Pain cannot be felt without the brain, which interprets nerve signals and transforms them into the experience of pain. Of course, it is important to be able to feel pain so we can protect ourselves from danger. However, these pathways often tend to get reinforced over time by our reactions to the pain. Just about everyone who has chronic pain will react to that pain with fear, anger, anxiety, frustration, and other worrisome thoughts and emotions. These thoughts and emotions trigger increased pain by an amplification process in the brain. Thoughts and emotions, whether we are aware of them or whether they are subconscious, are major factors in producing chronic pain and related syndromes. In addition, the stress that frequently accompanies these symptoms, such as decreased activity, decreased income, and more difficult relationships, adds to the problem by making the stress-producing neural pathways stronger. In this kind of situation, your brain will continue to produce pain because that's the only way your brain knows how to deal with these stresses. The truth is that your mind can twist your body into a cycle of very real pain. It's very common for people with difficult emotional experiences in their childhood or their recent past to have this same amplification of pain. In fact, certain traumatic experiences in childhood leave an imprint on the brain, making it more likely to develop the vicious pain cycle. People who have a great deal of unresolved stress are also more likely to have chronic pain. Almost everyone has stress to some degree, and in many people it results sooner or later in chronic pain that can range from mild and intermittent to intense and unrelenting. And there are many symptoms in addition to pain that can be caused by these wayward connections, such as diarrhea, insomnia, ringing in the ears, fatigue, bladder symptoms, and anxiety or depression. The term I have used for this condition is mind-body syndrome, or MBS, and most people have some form of it. A newer term we are now using is psychophysiologic disorder, or PPD. These two terms will be used interchangeably in this book. A lot of doctors have given different names to this same thing. I still call it TMS because that's what Dr. Sarno called it. So now the mind-body syndrome, TMS, from Dr. Sarno is being called MBS, mind-body syndrome. It just creates quite a lot of confusion. There's also PRT, pain reprocessing. So as long as you know it's mind-body, as long as you understand that it might be being caused by unprocessed stresses and buried emotions in the system, then you know that you're looking at the same thing. What this program offers. In the chapters that follow, you will learn about MBS. You will see how it can develop and why modern medicine is typically unable to solve the problem. Most importantly, you'll learn whether you suffer from this syndrome, and finally you'll be guided through a comprehensive program to cure yourself. I will also use the terms pain pathways, nerve pathways, and neural pathways interchangeably. They all refer to the connections between the brain and body that can transmit the normal non-pain signals or painful signals depending on which one the brain activates. Okay. Chapter 2, Medicine's Blind Spot. Too much light often blinds gentlemen of this sort. They cannot see the forest for the trees. That quote is from Musarion. I have come to the conclusion that there is absolutely nothing the matter with me anyway. Harry S. Truman on his decision to stop pain medications for neck pain. The key to treating chronic pain and other symptoms is to determine what is causing them. This is not only good medical practice, it is common sense. However, many doctors, whether traditional or holistic, are unaware that learned neural pathways can produce a large variety of real physical symptoms. As a result, we have a growing epidemic of pain. Many millions of people suffer, and many billions of dollars are spent on treatments that are often ineffective, such as pain medications, injections, and surgery. Despite the growing amount of money spent on treatment of these painful conditions, the results are disappointing. In fact, a study published in the Journal of American Medical Association found that back and neck pain is increasing in the United States, and the cost for caring for such pain has increased to more than $80 billion a year. Yet the newest treatments are not any more effective than the older treatments, and therefore disability due to back pain is increasing. In 2011, the Institute of Medicine released a consensus report stating that approximately 110 million Americans suffer with chronic back pain. Over the past 5 decades, medical science has progressed dramatically in several areas. We've made great strides in understanding and treating cancer. Have we? There's no cure for cancer in the medical system yet, Mr. Dr. Howard Schubiner. Heart disease, stroke, hypertension, diabetes, infectious diseases, and many other illnesses. The same. These achievements have been made possible by a biotechnological approach, by examining these disorders with a very narrow focus to find out what is occurring on a cellular and molecular level. This approach searches for a cure by examining the specific area where the disease is found. We can see the pathological changes in the body in people with cancer. A tumour, yes, we see the cells congregate into a lump called a tumour. Heart disease, damaged heart tissue, and infections, bacteria causing tissue inflammation. Also, I had a lot of gut infections, and I would counter that too. But these types of physically identifiable changes cannot be found in people with mind-body syndrome. That's also something that I would counter. Okay, it's a very interesting book. My personal experience was that there would regularly be things that would show on scans. I had infections and gut health issues, and you could see bacteria, you could see pathology changing. I had regular gut tests, and you could actually see what was there. However, it all got healed when I started using mind-body healing and stopped continually testing and monitoring. There is a lot to be said for learning to not keep monitoring symptoms. This is also the case with my cancer. So using the nervous system healing work healed up my melanoma, and I did go back to the hospital and have other tests, and they said you've got the all clear. They also said it was a miracle. But then from that point on, I didn't want to keep having tests and investigations, because I was learning that the best medicine for me had been to learn to live healthily and happily and differently to before. So to almost take my health back into my own hands. So my experience has been quite different to some of the things that he states. You know, and he's saying there's been a lot of progress with cancer treatment, but every generation of my family above me died of cancer, and recently too, some of them. So even with all the latest developments and the latest forms of chemo, they told me at my last appointment that they don't have a cure. So I don't know what he means. But he's suggesting that some conditions are mind-body syndrome and then other conditions are not. Whereas some other teachers suggest that if it's your mind and your body, then it's all connected. So for me, that kind of seems more logical, that if it's your mind and body, then what we're doing is restoring the connection into yourself. So it's not any particular condition that would be outside of that. Okay, let's have a look at the first chapter that starts the program, just to jump ahead so that in this video you get a flavour of the kind of exercises you'll be doing if you want to go through this workbook. Week 1, taking control of your life. I have much ado to know myself. William Shakespeare. I need to move, I need to wake up, I need to change, I need to shake up. I need to speak out, something's got to break up. I've been asleep and I need to wake up. Now, Melissa Etheridge. Anger is an acid that can do more harm to the vessel in which it is stored than to anything on which it is poured. Mark Twain. During the first week, you will learn the rest of the program. You will have these skills for the rest of your life. This chapter will introduce you to the exercises that are the basis of the MBS program, which include written and verbal expression, reflection, and reprogramming the mind. If you are new to this work and you are completing the full program, you can set aside up to an hour a day. However, not everyone needs to do that. There are many tools in the book, and I suggest that you pick and choose which ones fit your needs. When he says not everyone needs to do that, you might want to give yourself a minimum. I tend to say to people, if they're very severely ill, bedbound, can't really read, that 10 minutes a day of doing something for your healing is good. You don't actually have to do more. So I have free resources on my website, or it could be 10 minutes from this workbook, but I don't think you have to try and push to do an hour, especially if your window of tolerance is small. But if you can try and do something every day, that's going to be really helpful. And bearing in mind, I had to start with reading one sentence a day. I couldn't read at all, I couldn't look at screens. So I just picking up my Kindle and reading one sentence was all I could manage at the beginning. And that'll be it for the day. The time you take for yourself will change your life. The next 4 chapters are packed with a great deal of information to help you in your recovery. I suggest you review the contents of each chapter before starting the exercises to get a sense of what you will be doing. The program entails 2 different exercises each day, such as a meditation in the morning and a writing exercise in the evening. In addition, the reprogramming the brain exercises are meant to be used many times during the day, depending on your situation. Find out for yourself which exercises are most helpful to you and practice them at your own pace. Don't pressure yourself to do every exercise or to recover within a certain time frame. Doing so can actually delay recovery. Know that you will recover, relax, and proceed at your own pace. Okay, so let's look at one of the exercises in the later chapters, the workbook section, called Using the ISTDP Framework for Verbal Expression. As described in an earlier chapter, ISTDP offers a powerful method for dealing with emotions that have been held inside or not fully processed. Remember that you don't necessarily need to engage in ISTDP. Not everyone will, depending on their particular situation. The key aspects of this include actually experiencing the emotions of anger, guilt, and grief, typically in that order, and expressing them fully in order to release them. Because deep-seated resentment and anger underlie most of the issues faced by individuals with MBS, it is important to understand anger and how it can be used as a way to heal. The key to understanding MBS is the danger signal in the amygdala of the brain. In people who have been sensitized by life stresses, the amygdala can overreact to life events that are not actually dangerous. The danger signal activates a complex series of reactions in the brain and body, resulting in pain, anxiety, depression, or other MBS symptoms. Taken as a whole, this is commonly known as the fight or flight reaction. The fight or flight reaction is often described as a single uniform reaction, but fight and flight are separate and different reactions. Both reactions are marked by increased blood flow in the muscles, and they share many other features, but the emotional context is quite different. We run when our primary feeling is fear, and we stand and fight when it is anger. So fight or flight or freeze is commonly referred to as the survival responses. Fight means you will want to fight. You get sensations quite often in the fists. People get tingling in their arms and hands. Flight is when you would run away. So if you imagine a tiger is chasing you, you've got choices. Your survival mode will happen automatically in the body, and you'll either want to fight the bear, did I say tiger? Fight the creature, or flee, run away. And sometimes if neither is possible, we go into freeze, which is a collapse or shutdown state. And if you've ever watched animal documentaries, you'll see this playing out. Sometimes an animal that's being chased will just drop to the floor and act like it's dead. And sometimes that can save its life too, because the hunting animal doesn't necessarily kill it straight away. It might take it to its lair. And I've seen an animal then get up and run away. So fight, flight or freeze are the typical ones. There's also fawn, which is a survival reaction to that a lot of people are using. Okay. In many ways, anger serves to counteract fear. Ongoing fear activates the danger alarm mechanism, which leads to more pain, anxiety or depression, while anger leads to feeling powerful, which reduces the danger alarm mechanism and reduces symptoms. When someone hurts or abuses us, whether physically, sexually or emotionally, or when we are injured in some other way, we respond with fear of the hurt, abuse or injury. However, underneath that fear is always some degree of resentment and anger. When the injury is powerful, ongoing and or occurs early in life, there is often rage towards the offender. This program will help you to release anger in a direct and therapeutic fashion. However, simply releasing anger in general is neither helpful nor sufficient for healing. Many times the anger is held inside, is let out towards people or things who are not the offenders responsible for anger. Hitting walls and punching pillows isn't healing as an isolated act. Yes, if you put your fist through a wall, you're not healed. Yelling and screaming at friends or family members who are not involved in the original hurt doesn't work. Yelling and screaming at people, whatever they were or were not involved in, also doesn't work for your healing. Even if people who harmed you, you feel like, I want to go and shout at them, that is not a good healing activity. Deal with them after you're recovered. That's my suggestion. First, we're going to help you process all your emotions. And it's not about anyone outside of you. It's about you releasing what's been stored. Obviously, people who've been abused in childhood and then go on to abuse others are never acting in useful ways. These are forms of displaced anger, anger that is not directed towards the offender. It only serves to create more problems. Anger that is directed towards the offender is necessary, but it is important to release that anger in a therapeutic way. Releasing that anger by yelling at the offender in public or punishing or taking revenge on the offender is not a wise course of action and creates many more problems than it solves. Yeah, it doesn't heal you either. People unfamiliar with ISTDP often fear that this process will lead to actual violent acts, but this is a misconception. This model allows one to release that anger therapeutically in private. Then one can move on to address the other emotions involved and choose how to act publicly in regards to the offender in ways that are wise and useful for the situation. Getting started. You can do this work alone or with a partner or therapist. Yeah, coach. The role of the partner is to help you to experience the emotions by pushing you towards feeling them and by helping you deflect tendencies to avoid feeling or expressing them. Actually, so many people who have chronic conditions cannot feel their anger and cannot raise emotions. I have created many tools to help you connect to your emotions that you can access for free. Let's try this though, this is exciting. If you ask yourself to focus on the anger and resentment you feel towards someone who harmed you or hurt you, what comes to mind? In order to fully use this model, you need to go directly to that anger. However, we often go to the hurt. It hurts me to think of him, or I'm afraid when I think of that thing that caused me pain. He says, I'm afraid when I think of being abused. Yeah, I wouldn't encourage you to think about that actually. This is a form of a defense and keeps us in the grips of the offender. Thoughts make up another category of defenses. One may say, it wasn't so bad, or that person didn't mean it, or things like that happened in those days back then. These thoughts only serve to help us avoid the necessary emotion of anger. Another ploy the mind uses is to blame ourselves with phrases like, it was partly my fault, or I deserved it, or I should have done something to stop it. These thoughts turn anger inward and are destructive rather than healing. Often the offender is someone whom we love or feel we should love, such as a parent, sibling, other relative, or close friend. In these situations, it is common for our minds to come up with new reasons to avoid anger, such as, I don't want to be angry, or I don't want to hurt them, or I've already forgiven them. As should be obvious from the subject of this book, another way to avoid the anger is to develop pain, anxiety, and other symptoms in our bodies. When we approach anger towards an offender, our bodies might tighten with pain, we may feel anxious and upset, we may get dizzy or weak or tired, or our minds may have trouble focusing and lose our train of thought. If you notice any of these symptoms, recognize that these are also defenses. Let me know your thoughts. It's a very interesting book. There are a couple of versions. I wonder if you have the earlier one, which was Unlearn Your Anxiety and Depression, or if you have this workbook, Unlearn Your Pain, or if you're thinking of getting it. If you've done other courses on your own, or if you've worked with a practitioner, community and support for you is incredibly important for your nervous system healing. So thank you for being here. Thank you for being part of this community. I'll put a link to a roadmap to nervous system healing that shares what I used to get myself recovered in a very short space of time. It also has private meditations from me that are ad-free that you can access at no cost. Take good care of yourself.